We're joined by Dr. Mahendra Karpan, the Head of Medical Services and Cardiology at the GPHC, and today he'll be talking to us about COVID and all things related to the heart. Dr. Karpan, thank you for joining us.
Thank you very much for having me, and thank you for putting together this program.
Dr. Karpan, can we just start off by saying we're still in the COVID-19 pandemic. How important is it to also focus on your heart?
So it's important in many ways, but as you quite rightly said, we are in the COVID-19 pandemic, and there are some schools of thoughts that are emerging right now to think that this is going to be a long issue that we're in. So we are going to have to learn how to live within this pandemic for a long time to come. At the same time, heart disease, etc., they do not disappear. So we still have a significant problem with persons suffering from heart disease. It still remains the #1 cause of death in Guyana and many places around the world and the Caribbean. So it's important to recognize that this remains a primary problem and to be able to address it in our population and persons to be able to take care of themselves.
Dr. Karpan, just quickly to follow up on that, this phrase has emerged, for lack of a better word, something called excess deaths as it relates to the pandemic, and when we're thinking about these other types of diseases, how has that phenomenon, do you think that's been occurring in Guyana?
Yeah, so in the early stages of the COVID-19 pandemic, a lot of persons were scared to come to hospital or seek healthcare attention. So they would stay home with their chest pain, stay home with their heart attack, stay home with their heart failure, their abnormal heart rhythm, because they're scared to come to the emergency room because of the risk of getting COVID or in any hospital. And for that reason, a number of these persons, unfortunately, would have died at home because they were unable or unwilling to come to the hospital. When that happens across the world, not just in Guyana, when you look at death rates, you would recognize that if you look at it across years, for example, the year 2020 and 2021, those number of deaths would have been increased compared to, let's say, 2017 and 2018. So that increase above those previous years is what is referred to as the excess deaths. So I suspect that that still happens to some extent, but perhaps a little bit less now that we're almost 2 years into the pandemic.
Can you say how great the phenomenon of excess deaths has been perhaps in 2020 and 2021?
So we don't have particular data for Guyana, but I can draw your attention to the data released from the US, for example, that in the year 2020, there were 700,000 excess deaths not attributed to COVID-19 during that period. So it means, therefore, that when compared to 2017, 2018, 2019, there was over 500,000 additional deaths. And that is largely due to the phenomena that we talked about. Persons not seeking or getting appropriate care in a timely manner.
Right. Sir, and something you mentioned earlier, you spoke about heart diseases being the leading causes of death here in Guyana. Can you tell us why?
So there are several factors that contribute to that. Some of it we can change and some we can't change. It is known that persons of South Asian descent have a higher genetic predisposition to cardiovascular disease. So that's a genetic thing, you can't really change it. Then there's also a higher level of diabetes, hypertension, all of the chronic disease that constitute risk factors for cardiovascular disease. But then of course, there's an increase in westernized living in Guyana, where the diet has become a little bit more skewed towards fast food and unhealthy foods versus our original farm-grown products. So these are some of the things that actually contribute. And then of course our primary healthcare system needs a lot of improvement. And elsewhere, every family, every village has doctors who are responsible for making sure that these persons in that area their blood pressure is normal, their cholesterol is normal, their blood sugar, etc. All of these basic parameters are monitored from the time they reach a certain age. In Guyana, unfortunately, the culture is you don't see a doctor until you get sick. And by that time, some damage has already been done.
So cognizant of all of these risk factors, so to speak, how do you as a medical professional, how do you deal with that?
So it's all about education and having people becoming aware of where they stand in terms of the risk factor spectrum. And so that with education, people can become empowered. They can exercise more, they can check for their diabetes, they can check for their cholesterol level, they can ensure that they stop bad habits like smoking, and essentially develop healthy lifestyle, have a moderate diet, and if they have chronic medical conditions, they can take the steps required to control those conditions.
Right, Dr. Carpin, and on top of that, coming back to something we started off with, COVID-19, how do people who have these conditions, heart disease specifically, which is the leading cause of death in Guyana, how should they navigate the COVID-19 pandemic?
That's an interesting question. It's very practical because these are both real issues, COVID-19 risk as well as the risk from your chronic disease. You still need to be careful not to be exposed to COVID, and you still need to control your blood sugar. You still need to control your blood pressure, cholesterol. You still need to have your checks done. So you have to find the right balance. Now, the emerging school of thought is that we will all, at some point in our lives, in the next months to years, be exposed to COVID-19, that it will be here for a while. We don't know exactly how long, we don't know, if it will just disappear, but if it doesn't, and it is unlikely that it will just disappear, it means that it will be here for a while to come. So we therefore need to give ourselves the best chance of defense when we actually do encounter the virus. So far, the best defense that we have had developed is the vaccination program. And it doesn't matter which vaccine you're talking about. All of the vaccines that have reached past stage 3 or phase 3 clinical trials and have been approved for human consumption have shown a remarkable safety profile and a remarkable efficacy profile.
I want to focus on vaccination some more, but just before I get to that, still on heart diseases, would you say people who have heart diseases, they perhaps are at a greater risk for getting the more serious forms of COVID-19?
Absolutely. That is not new data. That has been established since in the early days of COVID-19. Persons with heart disease, persons with diabetes, hypertension, kidney disease, immunosuppression disease, lupus, all of those things, those persons are at higher risk for bad outcomes when they get COVID-19. These are your asthmatics as well, the sickle cell disease patients. So those persons are at higher risk for really bad outcomes from COVID-19. And I'm talking about admission to hospital, admission to ICU, being put on a ventilator, and unfortunately, sometimes death.
So we're talking about them being at a higher risk on one hand, but are we actually seeing those types of persons being more affected? I mean, at the Ocean View Hospital, for example, people with these diseases, are they more of them admitted than, let's say someone who doesn't have these comorbidities?
Absolutely. When you look at the data, and we'll generally look at the ICU data at my level, but I'm sure the other parameters are being followed for all admissions, and there's a database that is available to Ministry of Health, etc. But it's quite clear that the persons who are admitted there are those who have higher number of comorbidities, the more diabetics, hypertensives, stroke patients, kidney disease, etc. All of those patients tend to have a higher mortality risk.
And would you say when they get to the hospital, that's a point of no return?
Oh, absolutely not. Every day, even though people unfortunately are dying, every day we are discharging patients who are better having been treated at the hospital. Now let me make it clear. There are no magic bullets, there are no cure-alls, but the basic measures that we have in place is what 95 to 98% of countries around the world have. A few places may have some tools that we don't have, but generally, Guyana is on par with more than 95% of the countries in the world. And guess what? Our mortality rate is pretty much the same as it is across the globe, despite differences in resources, despite differences in treatment protocol, despite all of the other differences. The WHO has recognized that across continents, the mortality rate for COVID-19 is between 2 to 3%, regardless of where you are or how your gross national product or gross domestic product is.
Okay, and would you be able to say what's the mortality rate here? Is it same between that same range?
So Guyana's case fatality rate, the last time I calculated it, was about 2.4%.
I want to segue into vaccinations. We've been hearing over and over that vaccines would help to protect people from experiencing these more severe symptoms of COVID-19. What's your take on that?
I agree with the science. All the authorities that are empowered to evaluate the data and to make statements and issue guidelines are very clear that vaccines do protect you from becoming severely ill, from being admitted to ICU, from being put on a ventilator, and from dying. We see that all across the world, and that is true for Guyana as well. We are not different. We are following the same pattern. Now, no vaccine ever in the history of mankind has been 100% protective against catching the infection. None. But it is the same thing that we are seeing now with the COVID-19 vaccine. There are breakthrough cases, but more than 95 to 98% of the time, it is protective against those same parameters that I mentioned to you. Admission to the ICU, being put on a ventilator, and dying.
You mentioned breakthrough cases, and I know locally over the past few weeks, we've seen quite a few, well, I wouldn't say quite a few persons who were fully vaccinated, but unfortunately they died as well. Would you say it's just a case of it being a breakthrough, or are there other factors contributing to that?
There are definitely other factors. Almost 100% of the breakthrough cases that unfortunately died are persons who have had severe comorbid conditions. Stroke survivors, diabetic patients badly controlled, recent heart attacks, etc. So yes, the breakthrough cases, as by definition, are those who are fully vaccinated at least 2 weeks prior, then get COVID. That is still possible. And unfortunately, we see the bad outcomes in persons who have severe multiple comorbid conditions.
So cognizant of that, do you think that might be contributing to vaccine hesitancy?
I believe the greatest contributor to vaccine hesitancy is a lack of proper communication and education. It is not, and in this day and age, there is so much misinformation that is available, especially online. And it depends on who you listen to. Because, these things, a lot of people have opinions, and if you say it over and over, then some interpret those as facts. We have to be careful where you get your facts from. I stick to the WHO, the CDC, Ministry of Health, the Caribbean associations, etc. So these are all reputable bodies with persons who are actually trained and qualified to analyze data and make statements.
Right. Dr. Carpin, another theme I want to head into also. Again, you mentioned heart diseases being the leading cause of death in Guyana. We know the COVID-19 pandemic is enduring. What is it like as a medical professional navigating this situation?
You have to do what you have to do. People coming in with heart attacks, you have to treat them. People coming in with COVID, you have to treat them. People coming in with COVID, severe infection, and still saying, I don't believe in the vaccine, you still have to treat them, because that's part of your responsibility. You took on a job, and that's what it entails. So even though it's challenging, this is something that we do. And I want to tell you something very, very clearly. The doctors, the nurses, the healthcare workers who are turning up to work every day, those are the real heroes. The ones who make a conscious decision to turn up, those are the people that we all owe our lives to, our peace of mind to, because this is a war that we're in, a war against COVID. And those are our soldiers on the front line every single day. So we need to remember that. Every doubt we have, every time we take things lightly and act irresponsibly, remember those guys that are putting their lives on the line every single day.
Just something else also. Recently, the newsroom spoke to the Chief Medical Officer, Dr. Narain Singh, and he mentioned that if we continue to see a surge in cases, we might have to reprioritize the healthcare system. The health minister himself has said this too. Do you think we're at that point in time where health workers might have to focus more on managing COVID-19 and less on managing other diseases?
So we have had an ongoing conversation right here at the Georgetown Hospital, and I'm certain at the higher level of the Ministry of Health, this is what they discuss as well. There are steps that are already in place that prioritizes COVID-19 management. The establishment of the Lillian-Dahl Hospital, for example, follows a hub and spoke model where the sick patients are quickly transferred or encouraged to be transferred from the outlying hospital to Lillian-Dahl when they actually need advanced care. So we concentrate our forces, concentrate our resources at Lillian-Dahl, but we're not leaving the regions unattended, but we arm them with the tools to transfer the vulnerable patients as soon as they can. We have not reached a stage, and hopefully we never get to a stage where we overwhelm our physical infrastructure. We still have, a lot of elasticity in the system. What our main challenge may be is the human resource component. We are quite, satisfactorily positioned with consumables, bed spaces, etc. But we have planned, we have had a program in place, anticipating that perhaps, whereas we may be at 100 occupancy at the Lillian-Dahl Hospital, the team that is managing that hospital have been anticipating a 250 occupancy. So these are not things that will just creep up on us by surprise.
Do you think that we will have to see healthcare workers specifically working in different, perhaps more intense shifts or anything of the sort?
So that is indeed an important question. And at some point, we have to look at things like burnout, fatigue, etc. among the healthcare workers. But again, this is planning ahead and being able to put things in place. If we don't have the resources locally, we'll import the resources to be able to look at this. And I can probably hazard a guess that that mechanism is already being examined and looked at.
Right. Final question for me. We're talking about the burnout of medical professionals. I think it's about almost 2 years into this pandemic. They're still dealing with the regular diseases, the regular health concerns within our healthcare system. What would you say to your colleagues at this point in time as we continue to navigate the pandemic and the health system generally?
Yeah, so COVID has brought with it a paradigm shift in how we address healthcare. It's taken up pretty much all of our attention for the last 2 years. But the other things still remain there. They don't disappear. The uncontrolled diabetic, the HIV, the lupus patient, the cancer patients, they don't just disappear. Those diseases don't disappear. And I'm quite certain that our physician colleagues outside of the COVID scenario continue to see patients, continue to offer care, and our nurses continue to turn up to work. All of the ward attendants, the porters, the security guards, the pharmacists, the x-ray technician, the lab technician, people still come to work. They protect themselves the best way that we have available now. I believe last check this morning in my department, they had 100% vaccination among the physician staff. So people are doing what we can to be able to protect ourselves and to continue to take care of our patients.
Anything else you want to add?
No, I just wanted to make one appeal to people to look at facts from reliable, credible sources. And right now, even though it is not a cure, it is not the only thing available, right now the best protection that we can give ourselves, apart from wearing masks, social distancing, and sterilizing, sanitization, is to get yourself vaccinated.
Thank you, Dr. Carpin.
You're welcome.